There are two new programs for Hattiesburg Clinic that we offer our patients now for traditional Medicare patients. One is called the annual wellness visit, where a patient comes in once a year at no cost and has a wellness visit screening done with a highly qualified nurse. The second program is called the chronic care management service, and that is provided with a phone call interaction between the patient and a nurse who works for the primary care physician. And it really helps keep the patient and the physician more engaged on a regular basis outside of what's already happening in the office. The annual wellness visit is a once a year visit with a nurse, and the focus is really on disease prevention. So, really trying to identify problems before they're really known. So, really a focus on screening, cancer screening, depression risk screening, screening for a risk for falls, and really a focus on trying to keep the patient healthy as best we can. The chronic care management program is a new service to Medicare patients where we are able to reach out to the patient at least once a month with a highly qualified nurse who's interacting with the patient on a regular basis outside of what's done in the office with the physician to keep connected with the patient, really focusing on diseases. So, for instance, if a patient has hypertension and diabetes or a patient has COPD and depression, we can call that patient once a month, at least once a month, and interact and make sure how well they're doing so that we can keep things on track in between office visits. During the nurses' communications with their patients, they may determine that there are issues that need to be addressed by a physician or other healthcare provider. In this case, the chronic care management nurse will contact the primary care office to help coordinate the patient's needs in a timely manner. The chronic care management program costs about a little less than $8 a month per patient, assuming that that is not covered already by the secondary insurance. A consent is required between the patient and the physician in order to provide these services. These programs have been great for our patients and great for our physicians because they really are they're a way that we can keep our patients and our doctors connected. So there's more interaction in between office visits. So if a patient's seeing the doctor once every 3 months or every 6 months, we're able to check on that patient more regularly than that so that we can identify problems before they get too far off track and get the patient back in sooner if we need to, or just have that interaction to let everybody know that everything's going okay.